Just about me, I'm an infectious disease doctor, and I'm the country director for the U.S. Centers for Disease Control Office, or CDC, our office in Tanzania. And so so what is the CDC, right? Well, the CDC is basically a part of the U.S. Department of Health and Human Services, which is the Ministry of Health of the United States. And our role is to, with other parts of the Ministry of Health of the United States, with Health and Human Services, to protect the health and safety of the American people, right? Make America stronger, safer, more prosperous. And we do that through a few ways, okay? So in the United States, the CDC helps our states, the equivalent of regions in Tanzania, to control the spread of disease. We also help states figure out, how to make their people healthier, how to control, let's say, hypertension, coronary disease, heart disease. So maybe the question is, why are we overseas? Overseas, our mission is the same, to protect the American homeland, right? So how do we do that overseas? That's just something people to really think through, that our experience the last couple of decades with disease outbreaks and so forth, the epidemics, is that a disease anywhere is a disease everywhere. So, maybe in the past, if there was a disease, let's say in DRC, or if there was something in Nigeria, or if there was something in Amsterdam, right? Well, that really was a problem for those communities, but wasn't going to affect the world.
Right.
I think it's pretty clear that that's not the case. And so we at CDC, as part of the U.S. mission here, we have a few roles. Our primary role is to keep America safe. How do we do that? We work with the Tanzanian Ministry of Health, right? We partner with them to strengthen the ability of Tanzania to identify and control disease, right? So that is a couple things. One is that helps Tanzania. That helps the Tanzanian people, right? So Tanzanian people don't want to get malaria. They don't want to get HIV. They don't want to get COVID or hepatitis or anything like that. Number two is that when Tanzania controls diseases and helps their own people, they prevent those diseases from going to their neighboring countries, right? And they prevent those diseases from coming to the United States. The second element, quite frankly, is this is part of America's diplomatic outreach to Tanzania, right? America wants to have a prosperous, stable, strong relationship with Tanzania, one of partnership, where Tanzanians benefit and Americans benefit, and that is part of our work as well. So we're there in those two elements, right? Keeping America safe and really improving and strengthening the relationship between the United States and Tanzania. Great,
thank you. That's very comprehensive overview. We've all seen the recent outbreak of Marburg virus disease in Kagera. So I wonder if you can talk a little bit about some initial steps that you, with CDC, took in partnership with the Tanzanian Ministry of Health.
Yeah, and just for our viewers, what is a Marburg virus, right? A Marburg virus, is a disease that actually is quite common in certain animal populations. So, for example, bats actually have it, and bats seem to have no problem with Marburg virus, right? In fact, the fruit bat population across this part of Africa, Uganda, Tanzania, Kenya, Rwanda, they have this disease. Doesn't seem to do them much harm, right? However, as human beings have gotten closer to animals, right? As we, for example, expand farmland, right, into the habitat of where these animals live, or, for example, going to bat caves to collect their dung to help fertilize our fields, or, for example, to maybe use them for food, right? We become at risk for acquiring that virus. That virus in bats is in their saliva, their urine and their blood. And so it's very easy for these viruses, when we get close to bats, for them to affect us. So quite frankly, very likely that's what happened in Kagera, right? We were the Tanzanian Ministry of Health in the region of Kagera identified an outbreak of Marburg virus and reported it to the world, which is really critical, right? Because that report does two things, right? One is it tells the people of Kagera what's happening so they can protect themselves, right? And when we talk about Marburg virus is usually characterized initially by fever, and then if it gets very severe, you can get confused, you can start bleeding, you can get quite sick, right? And the way the disease is transmitted is by coming too close or touching, someone with Marburg virus. So when you announce a disease, you help a population figure out, like, what do I do to protect myself? And the way they protect themselves is, okay, someone is sick, well, they should go see a doctor. They should go to a clinic and say, well, what's happened to me? Now, maybe they have Marburg, maybe they have something else, maybe they have malaria. They get treated for malaria, they're feeling great, right? They get much better. And then the second is, how do you protect yourself from getting infected? So the Ministry of Health did a very good job of saying, listen, we need to stay away from bats, right? We need to stay away from people who are really sick, and those really sick people should go and they should, seek treatment, right? With that announcement, also, that enabled the Ministry of Health to mobilize resources. So CDC, for example, in partnership with the Ministry of Health, helped deploy people to those communities to help provide that education, also to help figure out if somebody is sick, make sure they got that support. We also work very closely with them to figure out how to test for the disease, right? So Marburg virus looks like malaria, quite frankly, at the beginning. So how do you know? What do you have? You need a blood test. And we really provide a lot of support for that in terms of the blood test. And then finally, I would say that we did a tremendous amount of work in terms of helping the Ministry of Health keep track of everything. It's actually pretty complicated, right? Kagera has hundreds of thousands of people. How do you actually keep track of the people you've talked to, who has cases and so forth? And so really, I think that was really where our partnership was. And I have to say also, when you talk about partnership, yes, Tanzania benefited from that, but also we benefited as well. One is Tanzania successfully controlled the outbreak before it spread, right? That's really important for the interests of America. And also, Tanzania's contribution to science is actually critical because it helps all of us, the entire world, understand this virus better. So one, Tanzania can take steps to prevent future outbreaks, and so can its neighboring countries.
That's wonderful. So can you talk about what led to the declaration that the outbreak was over? Because you did say they successfully controlled it, but how do you guys make that determination?
Well, we make that determination by saying, basically, we start where, viruses have what we call an incubation period, right? So for example, when a virus infects you, right, infects someone, you don't get sick right away. Right? Usually it takes several days for that virus to get into a cell, to get into your body, to multiply, to start causing symptoms. So we know now that for Marburg, the incubation period is 21 days. So we know, okay, this person is the last case that we have, and we have been tracking the people who are in contact with this person. And so we track them, and we say eventually, okay, we have been tracking these people over this period of time, and they are not sick. So now the outbreak is over. There are no more cases. Now, I just want to take a step back. That doesn't mean that there aren't going to be cases in the future, because, as I said, this virus lives in the animals that are in our communities. So the next step then is really making sure that we prevent future outbreaks, and that's through education, staying away from animals that may have disease, and also if there's a case, that we act on it quickly. So if someone has Marburg virus, the most important thing is that person needs help.
Yeah.
Right? That's the most important thing. They need to be tested and need to get help, because we really care about their outcome, right? We want them to survive and go back to their families. And then with that information, we're now able to prevent that disease from spreading.
Great. No, thank you. So I'm really curious. This is not the first outbreak of Marburg virus disease in Tanzania. You guys did not just deploy these resources just in response to one outbreak, but as you mentioned, the office has been here since 2001. So can you talk about what kind of long-term investments or collaborations that you have here in Tanzania that help in the quick response to a specific disease outbreak?
So our office opened here in 2001, but honestly, I think we have been partnering with Tanzania, and actually countries in the region, for much longer than that. The US CDC was a key part of the coalition of public health agencies, multilaterals, and countries that helped eliminate smallpox from the earth, right? So there has been, and also CDC has been part of the worldwide effort to control measles, to control polio. But in 2001 is the first time we really have a full-time office. We now have staff who live in Dar es Salaam. And that office was originally here to really support U.S. government's partnership with Tanzania to control HIV, what we call the President's Emergency Plan for AIDS Relief, or PEPFAR. And we are proud to say that investment has been very successful with Tanzania, that Tanzania is very close to controlling the HIV epidemic. In fact, I think Tanzania should be very proud that the outcomes in this country are as good as much wealthier countries. Tanzania has been very successful in controlling HIV. Now, since then, though, our partnership has grown to include tuberculosis, malaria control, and in this case, now what we're talking about is what we call global health security, right? So controlling, and what does global health security mean? It goes back to what I said earlier, that a disease somewhere disease is disease everywhere, right? So what global health security means is essentially saying, as a country, you identify, let's say, a disease or an infection in your community. Your number one job is to help your own people. So you control that very quickly. And by controlling that, you help your own people. But you also, right, are helping others. And so CDC's partnership has expanded with Tanzania for that mutual benefit that we as CDC are partnering with Tanzania to strengthen Tanzania's ability to do that work, to control those diseases. So when you refer to those investments in disease surveillance, in training physicians, epidemiologists, veterinarians, laboratory scientists, that training has been done with the idea that Tanzania's health system is being strengthened. The Tanzanian people are benefiting, right? I can tell you that the lifespan in Tanzania has increased, particularly because of our control with HIV, our partnership with HIV. And then those investments can also be used when there's an unexpected outbreak, right? When there's an outbreak of a new disease, or, as I said with Marburg, we are going to continue having outbreaks of Marburg. So now those investments can be there to, one, try to prevent or reduce the number of outbreaks, and also to control them as quickly as we can. So really, and that partnership has been successful, and I think we are looking forward to continuing that partnership.
Yeah, great. Yeah, you've kind of touched on this, but in terms of long-term public health capacity building, could you talk about how CDC's involvement has really strengthened Tanzania's ability to respond to future health threats? And maybe if you could assess, like, what, you know, in the course of the time that CDC has been present in Tanzania, how have you seen that kind of evolve? Yeah,
so, you know, what I have to say to our viewers is that what CDC is doing here in Tanzania is not dissimilar to what we do in the United States. So in the United States, our states, in many respects, have what we call sovereign authority. So almost like independent countries when it comes to certain things, and health is one of them, one of those areas. And CDC works with the states in the same way that CDC works with Tanzania for mutual benefit. Right, in this case, for example, the state of Texas, right? We work with Texas, we work with New York to help strengthen their ability to identify outbreaks of disease and respond quickly. And the reason is because if New York, for example, is able to stop something very quickly, then that protects Texas, that protects New Jersey, that protects Connecticut. That is what we do with Tanzania, right? So with health investments, right? For example, that's like we have helped train medical doctors, scientists in terms of how to identify and respond to disease. I will say that Tanzania has one of the best laboratory networks in Africa, where Tanzania now has the ability to identify a host of pathogens, and actually has the ability to identify new ones as well. I know that's funny. How can you identify something that you don't know, right? Well, actually, there's a whole technique. There's several techniques out there to try and look for the unknown, things that don't match with what you already know. For example, in viruses, where, you know, I have a list of viruses that you know, humanity knows about, but now I find something that doesn't fit that list. Tanzania has that ability, right? And you know, and has actually used that ability to look for things to rule out new pathogens. Also, Tanzania has really, in our partnership, we've really helped them support medical information systems. I think now, for example, if patients go to an HIV clinic, you'll see a laptop there, and your data is very easy to get to for you, the patient, but also provider, and it's also secure. Meaning that even though you can get the data very quickly, and you go to your provider and they can get your data, so wait times have gone down, life's more convenient, but it's also secure, right? And I would say those investments, Tanzania's public health system in many respects has gotten much stronger. As I mentioned before, the laboratory network is very good. And so they can identify things that we know and things that we don't know. Tanzania also has some amazing research institutions, right, that are able to do research, and in fact they partner with American universities to look at a host of things. I know I've talked a lot about communicable diseases, but I can tell you, for example, there's a lot of research in cardiology that occurs here, right? There's a lot of research that looks at sickle cell disease, right? So I think Tanzania does have strong public health capacity, and I think there has been really a dramatic improvement. Once again, under the leadership of Tanzania, I will give the government of Tanzania credit that they do take public health seriously, and I think that is why our partnership has been very strong, because they take it seriously, we take it seriously, and so there's that mutual benefit. Just one thing I want to add also along those lines, when we talk about the office here, right, we have an office of 83 people. However, 70% of that office is actually Tanzanians. This is really important. I mentioned that there are a lot of good research institutions here. There are a lot of good laboratorians. There are also good medical schools and training universities. And that means the talent pool in Tanzania is actually quite high. We have some really amazing people who work for us, who really understand the science. But I think this is really important, you know, as Tanzanians, they understand the context of Tanzania. You know, to be very candid, you know, I'm a foreigner, right? Tanzania is an old culture. It's advanced, it's complex. I've lived here for 4 years. I haven't even touched the tip of the iceberg, right? In terms of what being Tanzania is, what the whole, you know, it's a big country with lots of people, lots of diversity. In the same way that I think, what does it mean to understand what America is, right? That's a complicated thing. Right. I would say our staff, the presence of the office is key, because if we just fly in and say, you know, we're here to help, you know, obviously that's not going to work, right? First of all, we don't understand the situation, right? Also, quite rightly, we're coming in as strangers, right? If someone comes to your house and says, you know, I'm here to help you out, you're going to be like, why is that? Who are you, right? So really having the office here is really key, right? So I run the office, but the people who really do the work are Tanzanians, right? And I will say that there is a back and forth in our staff between Tanzania, the Ministry of Health, and other universities that we're, you know, we have staff moving between them and so forth, you know, that they're part of the same pool of scientists. And so really having those relationships and that local expertise is key, because without them, we wouldn't be effective. This would not be a useful exercise. And I think Tanzania's successes have been led by Tanzanians. Yeah. Tanzanians who are within the government, Ministry of Health, Tanzanians who are within universities, civil society, communities, hospitals, but also Tanzanians who work in our office. Awesome,
thank you. So, you know, as we discussed, Marburg has been declared over, but you guys are still here. So can you just talk a little bit about what current assistance and support that you're providing here in Tanzania on global health and protection outside of the Marburg response?
Yeah, so I think first our biggest program is our HIV program, and people forget that HIV is a communicable disease, and it's actually a global health threat. And we are really working with Tanzania to get Tanzania to that we say last mile, but we use the metric system here. So the last kilometer, right, to achieving epidemic control, right, where HIV ceases to be a public threat to the people of Tanzania. And we are very close, actually, that I think Tanzania is on pace to achieve that goal by 2030. Though, because we're ambitious, we're actually hoping that with Tanzania, we can get it earlier, right? We want to get this done earlier. We're also working with Tanzania still to prevent the reintroduction of polio, right? Tanzania eliminated wild-type polio decades ago, or years ago, but at the same time, there's still polio in some other countries, so helping Tanzania make sure that that doesn't get brought back. And then I think, you know, one of the biggest things really is sort of supporting the government in terms of responding to Mpox, right? You know, Mpox, for our viewers, you know, Mpox is a virus that actually exists in rodents, but when it is when people get too close to rodents, you know, when they're exposed to like the fluids, right, of a rodent, let's say their urine or their blood, you know, or their saliva, they can get a disease that looks a lot like chickenpox, except it's often much more severe. Now, and can be quite painful, right? I think many people have seen on social media and the news, and the disease is spread from person to person by getting, you know, too close to, let's say, the mucus or the saliva, you know, or blood of someone who has it, right? By close contact, you know, basically touching it, right? Touching the lesions. And there has been spread in this country. I think many people know that there's been a tremendous amount of spread in neighboring Democratic Republic of Congo. Now, I will say that DRC has a lot of challenges compared to Tanzania. I mentioned beforehand that Tanzania actually has a public health system that we are very confident can respond. And the government is responding through public health education and so forth. They are responding by having laboratory diagnostic ability, and we are partnering with them to improve upon those things. I do think that another area that we're more than happy to partner with them is on potentially rolling out vaccine against Mpox. There is a vaccine against Mpox. It's very effective. Neighboring countries have started employing it, for example, in Uganda. And really the key to vaccine is it doesn't help the person who already has the disease. What it does is protects the people who got in contact with that person from getting it. So if you think about it, if I have one case and then I vaccinate, let's say the family members or the healthcare providers that took care of that person, right? I've stopped the disease, right? And so we are, our support has been, as I mentioned before, laboratory, supporting public health education, training staff, and then we're really looking forward to supporting Tanzania in a vaccination effort as the country, deliberates on how and when to implement that.
Great. And you did commit a huge amount.
Yeah. So
recently,
so the U.S. government has committed $1 million. But I will also say too that when we talk about the U.S. government support, there's $1 million worth of support. That's new, right? That is new investment. But also, just to allude to our earlier in our conversation, the U.S. government's been investing hundreds of millions of dollars, actually billions, billions of dollars to help build up the Tanzania public health system. For those of you who play, sports, for example, right? You may practice kicking that penalty shot thousands and thousands of times, and you do that because of that one time where you actually may need it. Right? You practice. And so that is where I think we've been working with Tanzania. We've been helping Tanzania, working with them to practice and practice and practice to be able to respond to that, right? We are providing additional funds, but there's all that investment that's already occurred. And that's really key, I think, to thinking about our support. There's the support now, and then also all the capacity infrastructure that we have partnered with the Ministry of Health and the government of Tanzania to build.
Great. Thank you. I mean, this has been a really informative session, Dr. Mahesh. Do you have any closing words for our audience?
I think just to say that, one, thanks for having me on, but just really important, I think, to our viewers that the partnership between the United States and Tanzanian public health has been a strong one. It has been highly successful, mutually successful, and that there's a tremendous amount that has been accomplished in this country. And that accomplishment has benefited Tanzania, but quite frankly, it's benefited America. It's benefited us by keeping American people safe, making us stronger, making us more prosperous, right? Because healthy Tanzania is a healthy Tanzania that can buy American stuff, right? Buy American goods, where we can also buy Tanzanian goods, right? That are produced by healthy Tanzanians. And so I'm really looking forward to continuing strengthening that relationship and the improvement of our relations. Thank you.